Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Hello, Megan. How is it going?
Good.
It's good to be here with you.
Glad to be back. I know.
I'm glad to be back. Man, our conversation last time was fun. Constipation, right?
Heck yeah. We talk about poop all day.
For sure. Well, welcome everybody to another episode of the Pelvis Project. And we are going to segue off of that conversation we had last time. So if you haven't listened to our last episode, jump back on. We talked all things constipation and poop and all the fun things. And that actually has spurred a lot of thoughts and questions and dialogue about that area in general. So we're going to keep on with that theme because that seems to be an interesting topic of conversation. You ready, Megan?
I am. Let's do it.
Let's do it. We're going to talk today about tailbone pain.
Mm-hmm.
Dun, dun, dun. Here we are.
Yes.
Which is very connected to, or very close in proximity to the anorectal canal. And so that's how that's a segue. It's right there.
Yes. It's all right there. Literally, it is a pain. Literally, it is a pain in your ass.
Yeah. So the technical term for this is coccydynia because your tailbone is technically called the coccyx, but we'll just call it tailbone pain. I'm okay with that today, right?
Yeah, definitely.
So before we jump into this conversation, I'm going to spit a few statistics here. We don't always do that, but I think it's helpful in this just because it's kind of a tough topic that the general public doesn't know enough about. And so if you're feeling like, oh my, I don't even know what I'm going to hear right now, that's okay. And so one thing that we know, what we don't know is the prevalence of coccydynia. It just isn't well researched as far as like 1 in X amount of people have it.
Yeah.
We don't know those numbers, but what we do know is that about 25, 26% of the world's female population are affected by chronic pelvic pain, which is really sad if you think about it, 1 in 4. If we go then beyond that with another stat, about then 50% of women who seek pelvic floor rehab for a pelvic pain diagnosis or symptom also have coccydynia or tailbone pain. And so that's a big stat, Megan.
It is. I think it's definitely more common than we think. And we know just because of the field that we're in that we see so often men or women coming in, and it's kind of one of those things like, oh yeah, I've had tailbone pain forever. Again, it's kind of like blown off. Like it's not, they've never been validated for it. It's kind of just blown off. And listen, if you have tailbone pain, we're here to tell you, you could be taken care of. And we'll talk a little bit more about that because it really can be something that like, it might have been the injury was like years ago. And we'll talk more about how is it the driver or the bystander type of thing? But we hear that often where somebody was like on a slide or something and like hit a bump or a rock and landed on their tailbone and it hurt for a very long time. And then it didn't bother them for a very long time. And then now later in life, it's back again. But yeah, it's pretty crazy when you look at when you hear those stats, because we find more and more in this field that there's just so much that's not talked about. When you come in, well, I think with our episode a couple episodes ago, we talked about like what the conversation looks like with the therapist and how somebody comes in for one thing and then we ask all those questions and then you realize that there's a whole bunch of other contributing factors that are all related. So yeah, but let's talk about common things that have been told to patients about their tailbone pain that then is reported back to us. So I'll start off with this, Roxy, and pop in if there's some that you've heard too. So let's start off with, I have had people tell me that they have had tailbone pain for a very, very long time, and they go to a doctor and they say, well, and maybe somebody's on the thinner side, and they say, well, you just don't have enough cushion back there. And so they're being told that their tailbone hurts because they have less soft tissue around the area. So no. Or maybe you are trying to get back to an exercise routine, or you're not where you want to be physically. And so you're going to your doctor and you are telling them about this tailbone pain, and this is where you are in your fitness journey. And again, they blow it off and say, well, maybe if you were to lose weight, it would feel better. And again, no, we should be able to live our life and do these things and also not be validated in the fact that like we have pain there. And that's a frustrating thing. So we hear that a lot from our patients. We've been told before that doctors will just tell them to use a cushion, or Roxy and I were talking about people have been told to get a new car, a different seat that you sit on, or maybe they do an x-ray. And of course, an x-ray doesn't show anything. And listen, there's no fault of any provider or practitioner in this. It's all just a lack of like, nobody really knows what to do. I feel like tailbone pain can sometimes be this thing where it's like, oh, shoot, who wants to claim it type of thing. And I even know early in my career, if I got a tailbone pain patient, I was kind of a little at a loss of what can I really do? And now it being in pelvic health, I love treating tailbone pain. I think that we provide so much knowledge and skill in that area. So,
well, and you think about the intervention, like what real intervention is there for it, right? We don't put a cast on it if it's broken, right? Like,
right.
You could try pain meds, you can try that activity modification, right? But like for true treatment of it, there's nothing that's just feels really right,
Right. Yeah. And it's hard because, when you come in with somebody with chronic tailbone pain and they can't sit for longer than 30 minutes, or they come in our room and they can't sit down in order to have a discussion about their subjective, and they have to, sit on their off to one side or lay down, and your heart just breaks for them. Like there's just so much compassion for, it's so painful, and it's an area that has a lot of pressure on it. And most definitely there are things to help. And I know we've both probably had great success stories where there's those outliers, but when you have somebody come in that hasn't been able to sit for longer than 3 minutes for like a year, and you start a couple, 1 or 2 sessions, and they can suddenly sit for 3 hours. And even at that, they really don't have much discomfort. It's mind blowing. And I think that, and Roxy and I know you and I mentioned before we started recording that we are still in the realm of trying to remind providers and doctors that pelvic floor therapists are around and what we specialize in. And so now this tailbone pain kind of goes into another, it's not like OBGYNs and stuff. I mean, it can be, because you can definitely have tailbone injury from birth and that sort of thing, or tailbone pain while you're pregnant and all of that. But even into our orthopedic doctors, of remembering that there are subspecialties within the field that can and do know specific interventions and have no issue getting and providing those interventions without hesitation. So, yeah. But Roxy, tell us a little bit. Okay, so let's share with everybody kind of what other layers in the pelvic floor can refer pain to the tailbone, because often everybody has tailbone pain and they think there's something wrong right at the tailbone itself, when we know as pelvic floor providers that every pelvic floor muscle there pretty much attaches to the tailbone through fascia. We can treat the tailbone definitely while we're doing pelvic floor work, but this whole like referral pattern that we have in our body, there's definitely different scenarios for this. But tell us what can refer to the tailbone, because I think this is kind of mind blowing for people.
Yeah. And so when we talk about referred pain, like I think let me just clarify, first of all, that something can very much be wrong with a tailbone. You can have a fractured tailbone. You can have a bruised tailbone. You can have very much damage to that bone right there. Okay. But there also is this referred pattern that we see where the tailbone itself might be just fine. Yeah. And that's where if someone has gotten an x-ray and the x-ray findings show that it's unremarkable and that everything's fine, but you're thinking, my pain is not fine, right? That this is something is very wrong. Then this is then where we start thinking and we can practically think about this from an anatomical onset. So I'm going to just list these off, everybody. So if this feels overwhelming to you, don't be overwhelmed. I'm going to just list off some things. We don't expect you to even know what we're talking about, but these are all structures that when these structures that are not tailbones, when these structures are injured or damaged or irritated or dysfunctioning, they cause the tailbone to hurt or in that area to hurt. So here we go. Everybody hold on to your butts here.
Get on the horse and ride. Hold their butts.
Here we go. Obturator internus, coccygeus, puborectalis. Those are all muscles.
Those are all pelvic floor muscles.
Also then, let's go outside of that. The SI joint, which is above the coccygeus. L5S1, which is even further up in where the spine meets the sacrum. Gluteus maximus, the piriformis muscle, the adductor muscle. Those are your inner thigh muscles, the hamstrings. So that's a ton of structures. That's very global. That is not specific at all. If we were to take a picture of the human body and highlight all those structures, it's the entire pelvis, folks. Like it is anything and everything almost in the pelvis. And so if you're frustrated about your tailbone, quote unquote, being fine, but your pain not, this is where we know to go next. A lot of times that tailbone pain where we just zone in on it. At one point, it may have been the problem. And so if we think about then going back to, well, when did this start or what happened here? Okay, snowboarders unite here. I was skiing and I fell on my butt 100 times as I was learning how to snowboard, right? Whatever your reason is you had maybe an injury to that tailbone. And that initially that's what was damaged. That was what was injured. Now we're a long ways out from that, but there's still residual symptoms. That tailbone is healed, but there are other players now that are fueling that pain cycle that you're in, which then is maddening because then you've maybe gone to your primary care doctor, you've maybe gone to ortho surgeon, you've maybe gone to another PT, and everyone's trying all the things, treating the spine, treating all these things, which isn't a bad place to start. But we know from a pelvic floor rehab standpoint, what we're educated on is that we can look at this huge list of things, and that's probably where the problem is.
Yeah. And so that basically takes it, we're moving away from, like you said, the tailbone into some other areas, which then the tailbone feels better. And we might be working a pelvic floor muscle and someone say, oh my goodness, I feel that in my tailbone. And we've just reproduced the pain. So it really is kind of cool because we're investigating and looking deeper and finding more of now what the root cause is. And like Roxy just said, originally you had the injury, but now the root cause is a structure surrounding the tailbone that basically for a long time, our body likes to hug where it's had an injury to. And sometimes you have to get it out of that dysfunctional pattern. And that's what we're doing. And so at the end of the day, we're just trying to help people know that if you have had tailbone pain and you've, like you just said, tried all the things and it's still there, but you haven't seen a pelvic floor provider, that might be the next best step. And we would really encourage that. Okay. So then in addition to having tailbone pain, some other symptoms that you might be having that you haven't quite maybe put two and two together with, they definitely are related. Well, one that's kind of an obvious one is if you have any other pelvic floor pain, like painful intercourse, painful bowel movements, constipation. Pubococcygeus is a muscle that attaches from the pubic bone to the coccyx. So that muscle runs from anterior to posterior. And most definitely that's something that we're assessing when we're doing pelvic floor work. But I just listed those off, and then goodness sakes, I mean, hip pain, knee pain, foot pain, it really can go up the chain, down the chain. And that is something to consider. Again, we've talked about this before when we have somebody coming in and they might have another issue in another area of their body that they'll say commonly, I know this isn't your thing, but it is our thing because we're going to treat the whole body because the pelvic floor is that deepest stability point of our body. And if it's out of whack, for lack of better terms, it will affect up and down the chain. So Roxy, any final words on that?
I think that's all spot on. Just as we think about the tailbone, we think about pain, we think about the structures around that, and helping to bring hopefully some affirmation to people who have been struggling, or if you know someone that just has that struggles with that. I think this is a conversation that we want to keep going, but we're just starting these conversations on this podcast. We're just starting them, and wherever they lead to is going to be up to whoever finishes those conversations.
Yeah. So this is a short and sweet episode today about tailbone pain. And with the holidays coming, remember, you're going to be traveling, either sitting on an airplane or in the car, sitting and chatting with family, all those fun things. And remember, keep your eye on your tailbone. Don't sit for too long. And if you have tailbone pain afterwards and a literal pain in your butt, give us a call or look us up. All right, Roxy.
I love it. Until next time.
Until next time. Thanks for listening.
Bye.
Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.